Welcome back to another episode here on the Hart podcast. Today's guest, she walked away from med school and found herself leading one of the country's most life-saving nonprofits. This is Danielle's fight for access, for dignity, and for purpose. Ms. Danielle, welcome.
Thank you. Thank you for having me.
I mean, I'm excited. We were just kind of talking how it's been some time. Like
Yeah.
life really be lifing out here, especially with everything kind of going on, whether you're a parent, whether you're looking at what's happening in the government, the fear that's happening around the world. So it's always cool to just talk to another leader and just kind of, cut out all the noise for a little bit,
Right?
if anything. But let's start. I asked you the first question, man. You once dreamed of being a doctor, but then you ended up saving lives in a completely different way. When
Yeah.
did that dream actually start to shift for you? And did you know it was time to kind of pivot, or give
Yeah.
us the backstory on it?
I'll give you a little story about how that happened. So, I was a kid and I always dreamed about being a physician, specifically emergency medicine, because I have this like innate drive to like solve problems. And I'm like, oh, this is great. Like every day is going to be a new day, right? And I'm going to be faced with different challenges, and that's really exciting for me. So I went to the University of Central Florida. I got an undergraduate degree, a bachelor's in molecular and microbiology, and was doing some like rotations, like informational rotations, right, as you do in pre med. And I shadowed an emergency room doctor. And I remember, and this story chokes me up, so I'm going to try not to cry. But he showed, I was following him around, and this patient came in. He was probably in his 50s or 60s. He had just had a heart attack. And I'm like, okay, Danielle, like this is something you probably see in the emergency room like every day, right?
Right.
And I stood there to the side while they tried to save his life. And ultimately, they weren't able to get to him in time, and he passed. And there's rooms in the emergency room. I don't remember what they call them now, but where they take the families to basically tell them, right, that your loved one has passed.
Hmm.
And so I'm standing there, and the gentleman, passed away on my left, and I'm watching his wife, who's hysterical, and his children walk through the door, and they're about to take them to that room. And I turned to the doctor I was shadowing, and I said to him, how do you do this every day? He was like, oh, you get used to it. And in that moment, I was like, I can't get used to that. Like,
Yeah.
that's not for me. That human element, like, I don't want that to disappear from me, right? That empathy, and I get why they do it, because they have to disconnect. Otherwise, it just breaks you down emotionally,
Yeah.
and mentally. But that was the moment where I'm like, okay, I think I need to solve the healthcare problems in some other way. So I transitioned I got a master's in business administration and a master's in public health. And while I was getting those degrees, I worked as a scientist, a mycobacteriologist at the Florida Department of Health. So I've learned different facets of, healthcare in different ways. Um, Went on and got into the workers' comp industry, led a large call center there.
Hmm.
Learned about claims adjudication and all the inner workings of the technology involved in that, and then stumbled upon the assistance fund. And something about like a mission driven, quest to find better ways to do things and solve, the world's problems, right, was just so enticing to me. So that's why how I'm here today.
Life be really life, and I know we said it earlier before we actually hit record, but life be life, and for real, and you
Yeah.
just don't know. Sometimes you're chasing this dream and get completely taken off path and end up in a place that is like, wow, I'm so happy here. I would have never known.
Yeah, and
Um,
you gotta listen. You gotta listen. You gotta always be listening, because there's signs all around you, that your journey can take you in different ways. And if you don't pay attention, that you miss that, miss those
Missed that
moments.
opportunity.
Yeah.
Yeah, no, you're definitely wearing tune and realizing it very early on that I got to make this pivot.
Yeah.
I'm just like you. I couldn't do that. Like I just love people so much, and I'm the type of person that if I see someone crying, I'm crying with them.
Mm-hmm.
Like I get really emotional real quick. I don't know why, but that's just the thing. I see somebody crying, and I get. I mean, there's sometimes I hear really good stories,
Mm-hmm.
and I get emotional, and I'm like,
Yeah.
why am I like this?
Yeah.
So yeah, I can imagine. But do you feel there's a piece of your upbringing that still shows up in just the way that you lead? I mean, you being that young individual, that was a very leadership moment, realizing, you know what, this is not for me. I need to make that move, and doing it so, young. Is there anything that you can think of that stems, to this great leadership?
Yeah, I'm just curious by nature, right? And I have this, drive to always want to show up and be the best version of myself every day. It can be very exhausting to be that way because you get to moments where you're never satisfied. Unfortunately, I'm always looking to just do something better or bigger, right? But I would say, I grew up in the Poconos, very small town in Pennsylvania, and that upbringing in that small town, I think, still
Mm-hmm.
humbles me today. Um, what we do at the assistance fund and provide copay assistance for these patients, a lot of it is rural type areas where they don't have access, right? And I'm constantly pulled from pulling to my upbringing, right? Like I think about those individuals in the towns where I grew up, right? And the access to renowned physicians or science and technology is just not easily accessible there. So I think that upbringing really drives a lot of my devotion to this area of work as well.
So amazing. A young leader too. Like this is always cool to see the young leader doing phenomenal. I can imagine there were some challenges, but I do want to talk about something that you mentioned the first time that we got on a call, which was you don't know you need us until you need
That's
us,
right.
and that's really what's the most unforgettable moment that made that model really real for you?
Uh, I would say, I meet people all the time that, struggle to pay bills. I mean, there's, even if they're not healthcare related bills, right? Right now, in the state of, where we're at in the country, there's a lot of individuals that struggle every day. And you have moments where, I meet these parents of children that are just say, gosh, I have to choose between giving my child their medication and paying rent or putting food on the table. Um, and those moments really stick with me. Um,
I
and
bet.
you don't know organizations like us exist until you're in the system, I like to say, right? So you receive this life-changing diagnosis, and you learn about the costs of medication just to improve your quality of life and treat yourself,
Hmm.
right? And then all of a sudden you're burdened by this cost, right? So insurance only covers a part of it. A lot of these drugs, just because it says it's covered on paper, doesn't mean that you're going to be able to pay what the copay or coinsurance or deductible is, right? To get
Yeah.
the medicine. So I always say you don't need to know until you need to know, right? And then,
Correct.
I'm meeting people that, oh my gosh, I'm so glad I stumbled upon you guys. Because these individuals would have had to pay for it out of pocket and figure out a way on their own.
How do you navigate that emotional tension? Like as you mentioned, these are people that are technically insured,
Hmm.
still drowning,
Yeah.
right? So what do you guys do at the level of your organization that really gets these people squared away where they don't have to worry about, as you mentioned, paying rent or paying for medicine?
Yeah, so TAF, the Assistance Fund, we call ourselves TAF. We're the
Hmm.
last payer, so we help with the patient's out-of-pocket costs after their health insurance has paid its portion. So that could be co-payments, co-insurance, deductibles, as I said, and then any incidental medical expenses. So, you know, like I said, people assume that you have health insurance, you're protected, but the reality is it's very different. I meet families every day that still can't
Yeah.
pay and they have insurance. Um, so that's where we step in, right? We help bridge that gap. The fact that organizations like us exist and that we've helped hundreds of thousands of patients afford treatment really says something profound about our healthcare system, right? And there's cracks in it. That even as an insured patient, there's individuals that can't get access to the medication.
Hmm.
So our organization really shines light, right, on the patient's hidden financial burdens. And we're not only helping individuals, we're exposing these broader systemic issues in our healthcare.
Yeah.
And as a mother, I would fight for my son, right? I think we all would fight for our children. I would swim upstream every single day to give him what he needed. And
Hmm.
that's what we give our patients, assistance with dignity, and that they're no longer in this fight, alone.
Do you feel like something has shook you about the reality behind the scenes of healthcare? I mean, you stepped into this probably thinking this work is expecting to help. You stepped into this role and instead really found that, as you mentioned, the system is quietly failing people. Is there something that you think about that kind of shook that moment for you? Like, oh my God, this is actually a little bit more complicated than what it really is.
Yeah, our healthcare system is very complicated. um, you know, I even to be your own advocate nowadays is so challenging. I'll talk to family members or friends or family, and I'm kind of like the go-to person now, right? Hey, this individual's struggling to pay for this. Do you know of any help, right? And you would think this with this, the access to information that we have online, that it would be easy to find help, and it's really not. Um, I yeah, it's sad that we're in a system where it often fails the most vulnerable of our patients, right?
Yeah.
Or citizens. So
And it's not any better now, right? Like people are living in fear to even just get to the doctors nowadays because of what's happening in our government. But you still have this strong head on your shoulders. You still show up with a smile on your face. Can imagine that is not easy. Who's pouring into you when you're kind of going through these tough moments of, oh my God, can I get through this? Oh my God, how do I get through this? Who's that person in your corner?
gosh, I don't know if it's one person. That's a really good question. Um, I think it's a combination of people. You know, Obviously being a mother, I think has shifted a lot. My son has taught me so much about patience and empathy and resilience.
Patience for sure.
Yeah, like yeah, being a parent really just you learn a lot of lessons. If anything, you learn a lot of lessons. But the lessons I learned from him helped me be a better leader, right? Leading an organization like ours, I want our staff to always stay committed, right, to the mission. And
Hmm.
in order to do that, they have to feel appreciated. I have to make sure I'm setting up the culture to be one where they want to be here and they feel valued, and they feel like they're a part of this, shared purpose, right, to get us to help patients. Um, I have an amazing leadership team that surrounds me. They are trusted advisors. We've worked with each other for 9 years. I consider them part of my family, not
Yeah,
necessarily.
yeah. At this point,
I'm just lucky that I get to work with people that I've worked with for so long, that they're a part of my life. They're not just a coworker, um, and they're a constant. Um, they constantly give me in vigor to keep going, and and that we're moving in the right direction, because you can't be positive all the time, right? There's times as a leader where you question yourself,
of course.
and you have to surround yourself with people that give you that kind of vigor, right, to keep you going.
Yeah, no, I'm a big believer in that. That's why I'm always when you're a leader, we're not taught how to pour into ourselves while
Hmm.
we're pouring into others, right? So I think that's always kind of that thing is who can we call upon? Who are we checking in? We can't check in with everybody because some people start to drop in more negativity, and I'm like, I'm already empty. I don't need all the extraness.
Right.
And
Yeah.
and we all experience that
Hmm.
as leaders. Like that's just kind of life. But knowing that you have those solid people,
Hmm.
and really you created that foundation. I love what you said. Is like having the. I just created a content piece on this. Is your to have a steady foundation, they have to feel seen, they have to feel heard, they have to understand what the why is, the
Right.
mission, and once they do, and you allow them to be themselves while doing that as well,
Hmm.
allowing them to know it's okay to fail, that they don't have to be perfect because none of us are,
Hmm.
that you'll start to see a whole different team. And that's the reason I've always loved, and I haven't done it really in a long time, but when you get a good team. Now that I'm thinking about it, I have a board, and today we're actually going to start planning for a gala. So I'm so excited
Oh,
because this is a board that was not doing anything for the last
mhm.
couple of years, that was not raising money. And one of the biggest things they said is like, it's just, it hasn't been fun. Like we feel like we're not fighting for anything,
Right.
and that was past leadership. So now that I'm excited, and I text them like, hey, pizza today, we're about to really have fun. You have to set that tone. And I think so many
Mhm.
people forget that, like especially when they get into a new role. It's like, never forget how you got there.
Right.
And this, so I love that you kind of mentioned that space. You became a CEO though after 9 years, not
Mhm.
overnight. Took some
Yep.
time. People think that it happens, and oh my God, you're so blessed, or you're so lucky, but they don't know that it takes some challenges. What did that slow burn really teach you about yourself that a fast promotion never ever could?
Yeah, people ask me this question all the time is, how does it feel to be the CEO now? And people have a misconception of like being a CEO, oh, you're the boss, right? And everybody listens to everything you say, but it's lonely at the top. They say that
Yeah.
it's lonely at the top. Um, I sometimes I have it. Sometimes it hits me still to today that I'm running an organization, that people believe in me and believe
Mhm.
in my ability to take the organization where it needs to go. And I think that I'm fortunate in that my journey with the organization, I was exposed to so many different areas. So I had a lot of opportunity to learn. Starting as the VP of operations, which is largely what the organization is doing, right, every day.
Mhm.
The program management, then coupling that with being in charge of communications and finding alternate funding sources and building that foundation, I was exposed to so much in a short amount of time. Um, and building that constant, keeping up with that momentum and continuing to learn and expose myself to different parts of the business, I think helps with the organization, trusts that I know the ins and outs of this place. I know the ins and outs of, independent charitable copay assistance. I've put in the work. I know how to process claims and answer phones, right? I've been there. Um, I've been process. When I was a VP of operations, I would find myself processing reimbursement claims to patients on the weekends and at night because it bothered me so much to know that somebody was going the weekend without being able to buy food.
Mm.
So knowing that all of that was still sitting there, waiting to be paid out, I had to do it. So I think that foundation was really critical in my growth. Taught me a lot in a short amount of time. It seems like 9 years went really quick, but maybe to some people 9 years is a long time. But it seems like it went by very, very quickly.
If the Heart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure you guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. Shows how tough. I actually spoke to a leader. She waited 35 years to become CEO, and she
Wow.
was working with that organization for 30 plus years.
Yeah.
And she had this, it's just crazy how, yeah, it does go by fast.
Yeah.
But when you're in it goes by like it takes forever and a
Yeah.
day, because
Yeah.
a year could feel like a long time when you have this goal and you're like, what the hell? I'm just not getting it. Where is that?
Yeah.
But that's good that you stuck it through. All those titles, were you holding it at the same organization, or this is various?
Yes, same organization. Yes.
Oh yeah, so you understand what the front line looks like to all the way to the top.
Yep.
So you're one of those great leaders. I love people like you that um, you don't just take up a seat and you don't know what the hell's going on. No, I've lived it.
Hmm.
Okay, so I'm speaking from experience. When I'm giving you these stories, it's because I know.
Yep.
I truly do appreciate it. Do you think there's anything that you had to unlearn though, going from, I don't know how much time you spend in that for-profit world, but anything that you had to kind of unlearn from the for-profit while you get into a more mission-driven organization?
Yeah, obviously leading a mission organization is very different than leading a for-profit. So instead of fixating on quarterly returns or stockholder profits, we're focused on giving people access to
Mm-hmm.
critical medical treatment. But the pressure is still very real, right? But
Yep.
what's different is you carry it with pride now versus before you're like, oh gosh, this is just a job, right? I know that all of my worry and anxiety and making sure that I'm leading effectively and is all for a reason, right? Like we all want purpose in life, right? That's
Yeah.
what drives us and motivates us. So, and I think that that's yeah, I don't know if I would unlearn anything because for profit really helps from the business aspect, right? You to run a nonprofit, you have to have business acumen, right?
Yes,
It's still a
100%.
business at the end
Yep.
of the day. You have to be lean, and you want to make sure you're effective and efficient with the dollars that you do raise. You wear many hats. Many of us in the organization wear many hats because you want to be as lean as possible. So I don't know if I would unlearn anything because I think that all the stuff that the for profit I got out just in enough time.
Yeah. No, I do agree. People always have this theory that nonprofit doesn't make any money
Hmm.
and X, Y, Z, and it's that's not the case. I spoke to a nonprofit where they were making $70 million a year. They were bringing in, and now they're making $400 million a year.
Wow.
So yeah, these organizations do make some money.
Hmm.
It's an asking business. I've always been like, this is the asking
Yeah.
business in a sense, right? So you can't have no ego. You
Yeah.
cannot be. Got to be confident. Which you're also, what we sell is that story.
Right.
It's our patient stories. Some people don't get to actually experience it the way that you've experienced it. You
Hmm.
can talk about it from just being, what was it? You said you were intern. You were intern,
Yeah.
right? You have those stories on why you got there, and now that's what we actually sell. I think it's pretty cool. I think that you also hit it on the head. Your idea was never chasing a paycheck. It was
Hmm.
always chasing purpose,
Right.
and that's why you do what you do, and that's why it doesn't feel like work, and
Hmm.
that's what allows you to wake up every single morning, even when you have a child, to say it's not just about my child, but even bigger than that.
Right.
A lot of the times it's never about us. Now that I'm pretty sure it's not about us. It's about
Right.
everybody else that we could try to help
Right.
while we do what we do. Because as you mentioned, it is lonely on the top, but we're never afraid to help somebody else.
Right.
So I truly appreciate what you've really done. And you're building this nonprofit that in your ideal world really wouldn't exist. How do you stay motivated when your mission is to disappear?
Yeah. People find that interesting when we say that. Our vision is to see the day when no person goes without treatment because of an inability to pay, right?
Yeah.
So we often joke like our goal is really for us to go out of business because we're not needed anymore. And I say that as someone who is deeply proud of the work we do, but our existence is a response, right, to a broken system. So until then,
Hmm.
we keep showing up for the individuals and families who need us. At TAF, we are committed to increasing the number of disease programs so we can help more people right now, but also we support broader change. Charitable patient assistance is a critical stopgap, but it's not sustainable, right? It's not a
Hmm.
sustainable solution to the deeper issues in our healthcare system. So while TAF is here to meet the immediate need, we want the healthcare system to do better for the millions of people in this country who can't afford medical treatment. So, true progress in US healthcare would look a lot like our vision statement, where no one would go without treatment because of an inability to pay. And it
Yeah.
looks like access to care and treatment for everyone, regardless of
Hmm.
income or diagnosis, a place where everyone benefits from the science, not just a few. So you see the science, you see all of the new drugs and drug development and rare disease drug development focus, but it shouldn't be just for a few, it should be available to everybody. And it would mean closing the gap between what is covered by insurance and then the huge cost burden people living with life changing diseases face. So, long winded answer to
I love it. No, I love it.
why I would want us to not need to be here. You know.
We're in a space where you can probably attest to this, that organizations sometimes fall behind when we get to technology.
Hmm.
And now the buzzword is AI, and everyone's like, how do we incorporate it within our organization? Because we know that it's here. If people think it's not here, they're crazy. It's been here for
Hmm.
a long time. But there is some things that really help us at a level of admin, of repetitive tasks that allows us to get something done, like plug in AI to do that,
Hmm.
where we can do more of what we love. Are you an organization that is really implementing this? Are you guys like dipping your toe in it? Where do you guys fall as an organization with AI and technology?
Yeah, I would say that we dip our toe in it. For repetitive tasks, we certainly use AI to help. I mean, obviously, it would be silly for a nonprofit who's focused on efficient use of the dollars to not take advantage of things that, especially repetitive tasks that would help in productivity for our staff. So there's administrative stuff that we certainly use it for. I'm sure, like many organizations, meeting notes, things like that, right? That's saving our staff time. But what I will say is that because we have a call center and we're dealing with patients that are often coming to us, in not the greatest state in their life, right? We would never implement AI to replace a human, right? That human interaction and our patient interaction is so important to us. But we certainly will implement solutions and are looking at solutions that help our agents be more effective on that call, right? So getting the patient faster information, more concise information so they don't have to call multiple times, right? We're meeting all their needs in one phone call. So those are areas where we're exploring. I am a technology fiend. That's my, kind of side hobby. While I was pregnant, I got my Salesforce administration certification just for fun. um,
That's what you were doing, huh? When you were just at home, just hanging out,
yeah,
just
just
for
hanging
fun.
out, trying to keep myself occupied. So I do see the value in healthcare, but it's balance, right? Especially when you're talking about um, patients and different demographics and how they respond to technology. There's so much goes into the decisions when you're looking at solutions like that.
That's good. I love the way that you said, how do we help our call center and those reps be more faster
Mhm.
and accurate with the information? I think that's totally key because people, especially now, I feel like everyone, I used to say the Amazon effect, and now everyone's on the chat GPT effect.
Mhm.
Like they want information quick, right? We got to be that for them. That's just the time of life that we're on.
Right.
But I love that idea of how can we implement AI really, because to me, AI, I don't think ever replaces a person,
No.
but it makes our job a little easier. It's that tool in our toolbox that allows us to just be better at what we do and show up better. I
Right.
mean, it's happening in the healthcare now where doctors are showing up better and they can have one-on-one conversations without having to write all these notes, right? So
Right.
that's actually a good thing that's happening in the healthcare space, I would
Yeah.
say, right?
100%.
The
I mean,
experience is different.
we live in a world where I feel like we put so much pressure on ourselves to need to know everything. At at, just at the tip of our tongue, right? And so it would be silly for me to say our agents or expect our agents to know things about the hundred, close to 100 disease states that we support. I mean, that would be incredibly difficult for them to do. So, yes, certainly giving them the tools to access that information quickly and accurately.
This has been a really good conversation, but if someone's listening right now as we start wrapping it up and they've never heard of tafcares.org, what is that one thing you want them to know or do after this episode?
Tell somebody who's in need, right? So if you're, be the messenger. So I said you don't know us until you need to know us. Well, tell somebody, right? Spread the word. If you or someone you know is living with a life-changing disease, or you're having trouble affording your out-of-pocket treatment, we may be able to help. Visit our website. Our work resonates with you, we certainly always would encourage you to support us, by making a donation. Um, and 94 cents of every dollar donated goes directly to our patients and offering patient assistance. So I would say visit our website, tafcares.org, and there's a full list of our disease programs and information on how to apply, as well as information on how to donate, so we can help more people in need.
That's what I'm talking about. We got to get the resources out there.
Yes.
I ask you, after building a values led career, is there any quiet wins that remind you I'm exactly where I need to be? I know there's plenty of them, but what's the first one that comes to mind?
Gosh.
Got to
I
put you in
mean,
that. This is not even the blind question yet. This is a good question though.
uh, that it doesn't feel like work, I guess. That
Okay.
my dad would always say to me when I was young, when you're doing something you love, it never feels like work. So I don't feel like this doesn't feel like work, so maybe that would be the sign that I'm right where I'm supposed to be.
No, that's true. That is true. If
Yeah.
it doesn't feel like work and you just wake up happy every day,
Yeah.
like how cool is it to say, I love what I do?
Yeah.
Um,
And courage. I think that through this journey, my leadership journey, and figuring out what I wanted to do as I grew up, courage. I always had courage. So whenever people ask me as a leader, what would what advice would you give, or just always have courage. Fail, reflect, get back up. Because
got to.
you just never
Yeah.
know whose life you're going to change, that day. And if I didn't have
Hmm.
courage, I wouldn't be where I am today helping, you know, we helped over 40,000 patients last year, right? So,
That's amazing.
yeah.
And as you mentioned, just showing up truly makes a
Hmm.
difference. Sometimes people are afraid to show up. Just
Right.
show up authentically you, and you realize the rooms you're actually able to inspire
Hmm.
by just being you, by sharing that knowledge, by having that courage, being confident
Right.
in yourself. No, I love it. I love all those. As we're talking to leaders, especially in the I'm in the high school. I think I told you I lead the nonprofit in. You said you're in Orlando, right?
Yes. Hmm.
You know Edgewater High School.
Oh, yeah, yeah.
So I'm the president of Edgewater High School,
Oh,
and
nice.
to be at that school and just speak to these young kids and letting them know the nonprofit space exists, because I feel like it's something we don't talk about often. People
Hmm.
go and they chase that paycheck, but it's like, when do we tell kids to chase purpose?
Right.
Because to me, is when you chase purpose, the money would follow anyway.
Right.
But to have this thing that you can say, oh my God, I love what I do.
Yeah.
You could do 50, 60, 70 hours and it just never feels like work, because you see, you're just kind of almost getting your fix in a sense, right?
Hmm.
How good does it feel that I go home and I change all these lives?
Yeah. I mean,
You know?
it's an incredible feeling, and I'm sometimes you're in the day to day and you forget, right? And then I attend these patient conferences, and they come up to me and they tell me their story, and I'm like, oh gosh, like like you said, you cry, when you hear somebody else
Yeah.
cry, or you hear a story that's me. It's like, oh, it feels so good to be here, and somebody's benefiting from this. So,
You guys were recently at a conference, right? I think late
yeah,
April, early May.
yeah, we've been to a few. So, our staff was just at the sleep conference. Then we were at PPMD, which is muscular dystrophy. So
And you guys go there as like a vendor, or you guys?
we just have a booth. So our purpose is, right, to get the word out about the assistance fund. So patients who are visiting the conference because they have a particular disease, they
Hmm.
can gain information about us and learn about the financial assistance that we offer and how to enroll.
Okay. So you guys doing the work. You guys are out there, okay? You guys are making sure you guys. I love that. I love that you guys have the booth and sharing the information, because a lot of people show up, especially if you're doing it in Orlando. The Orlando Convention Center holds so many
They
people.
do, yeah.
Yeah, that you'll be missing out if you're not there. Okay,
Right.
that's a great partnership. All right, so I lead you to that blind question, as I mentioned. What belief about leadership or service has really stayed true, even as everything around you has completely changed?
Gosh, I would say listening. Um, listening is such an important part of leadership.
Yep.
It's, again, I said, like, people have this thought of what a leader is, right? And you're delegating, and you're, telling people what to do, but that's really not what it is, right? It's listening. And I think that's the most, important thing that I, have carried, is that it's not like I can do it on my own, right?
Hmm.
I certainly make final decisions on things, but I rely on the staff, and I listen, and I make sure that I'm taking it all in, and I'm making assessments before executing, right? So,
Yeah, listening. If my wife was here, she would echo, yes, yes, listening. She tells me that all
right?
the time. You just need to listen when I'm talking to you. I'm like, I
Yeah,
am listening.
yeah. But
I
listen
love
and
it. I love
actually,
it.
take it in.
That's what she says. Not listen to respond,
Right.
actually listen to understand. I'm like, oh my God. No, I enjoy this conversation. What is your blind question to our next leader?
if there was, if you could eliminate one world issue, what would it be and why?
I love these questions. I love when I get to listen to all these other questions that leaders ask each other. This has been really good conversation. Can people connect with you on LinkedIn? Are you on LinkedIn? Where can people follow
Yes.
you, the organization? Are you guys on social?
Yes, we're on all the social platforms. You could visit us, like I said, at tafcares.org. I'm on LinkedIn. Feel free to connect with me, Danielle Vizcaino. I'd be happy to connect.
I love it. Well, guys, this is another great conversation with another great leader and sharing resources that people don't know actually exist. So make sure that you guys tag somebody in the comments as well. Share this video with them because a lot of times people are living in the unknown. They're living in fear because they think that their help is not out there. But Danielle is letting you guys know that even if you have insurance, a lot of the times they will still be able to assist. All right, so make sure you guys follow them as tafcares.org,
Right.
right? tafcares.org. It's been a pleasure, Danielle. We thank you. This is Hart and Hustle Podcast. My name's Efrain. This is Danielle. We'll catch you guys on the next one.
All right. Thank you so
Latest.
much.